Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with board-certified OBGYN and well-woman care physician, Dr. Peter Tseng, and we're talking about preventive health care for women. So you hear a lot about preventive health care, and supposedly women are better at this than our husbands and male friends. But at what age should screening start for women?
Well, it depends on what we're talking about. Generally we can see even teenage girls, after they start to menstruate and have periods. But if they're not really having problems, pelvic exams probably don't need to start until they're sexually active. And pap smear tests, we actually don't start until age 21 now, but it can start as early as the teenage years.
So you break screenings down by different age groups. That's how they're recommended to you?
Yeah, generally, yeah, and every individual sometimes doesn't fall exactly into one age group, but the teenage years would typically be one group, between about age 21 up to age 40 or so would have their own sets of concerns and issues. 40 to 65 and 65 and older. Each group, again, tends to have specific kinds of conditions and concerns, and we try to address those.
All right, well, let's talk a little bit more specifically about those age groups then. So that 13-year-old through that 18-year-old, what are the biggest health issues or concerns they might have in that age group? They all look just young and healthy.
Well, this group of women, yes, is usually pretty healthy. When their menstrual periods are starting, there are some concerns that go along with that. Their sexuality, their bodies are developing, and some younger women are becoming sexually active as well. So we definitely talk about conditions such as sexually transmitted infections, diseases, pregnancy, and these can be results of sexual activity. But also, we can discuss issues with menstrual periods or problems.
So what kind of screenings do you typically recommend for this age group woman?
Well, for this group, if they are sexually active, we definitely talk about sexually transmitted infection or STD screening. There are certain types of infections, one called chlamydia, for instance, that is actually quite common in young girls who are sexually active. So screening these women all the way up to about age 26 yearly if they are sexually active. And there are blood tests that can be done, including HIV tests for sexually active girls. We also can talk about vaccinations that are available for girls age 9 to 26. The HPV vaccination is available. HPV is a type of virus that can cause certain types of problems like genital warts or cervical cancer.
So those would be the main screenings. And then, on a true wellness, I'm certain you look at like their nutrition and emotional health, that kind of thing.
Yes, definitely just their general physical health and nutrition, so eating healthy, being active, and taking care of their body as their bodies are changing. This is very important as well.
So let's go then to the next age group then, which if I remember right is like 19 to 39. In there, what would be the chief health concerns in that age group?
Well, this is at about age 21 we start to do cervical screening or screening for cancers or precancerous changes of the cervix. This tends to be done with pap smear testing and also can be done with HPV testing as well, or a combination of the two. This group of women also is very important to talk about family planning, and are there birth control options, or is that necessary? Good nutrition, regular physical activity, and just maintaining a healthy body.
What screenings are routinely ordered on this age group of women?
The Pap smear test, again, after age 21, we no longer routinely do Pap smears every year. Most women can go at least 2 or 3 years between Pap smears. And again, this is for healthy women who are having normal Pap smear results. We talk about self-breast awareness to monitor their own breasts, not specifically doing exams on themselves at given intervals, but just being aware of changes, like changes in the appearance of the breast, unusual puckering or dimpling, or certainly if they feel a lump in the breast, these could be addressed as well.
Who is most at risk for cervical cancer? You had talked about screening for that.
Well, most cervical cancer seems to be caused by certain types of this HPV virus, or human papilloma virus. Women who are not sexually active, or especially who have not been sexually active, are at very low risk for that. Women who are sexually active, who potentially could be exposed to HPV, since it is generally passed sexually, could be at greater risk for that. Women who have multiple sexual partners, or who have had multiple sexual partners over time, certainly would be at a greater risk as well. Women who smoke, women who have problems with their immune system, women who are HIV infected, for instance, don't have an immune system which is as strong, so they can be at certainly greater risk for those types of infections, and therefore greater risk for cervical cancer.
I also noticed that mammogram wasn't a routine screening, and yet we've all heard stories of young women with breast cancer. So how does that work?
Well, mammograms usually aren't started until typically about age 40 for most women. There are some groups of women who are at a very high risk for breast cancer who may need mammograms at an earlier age. But generally, when the risk for breast cancer is low, such as a woman in their 20s or early 30s, mammograms tend to have a very high false positive rate, meaning there will be findings on mammograms that generally end up not being cancer. And for that reason, it seems like it would do more harm than good for most women in the younger age groups. Women who have a very strong family history of breast cancer, like a mother or a sister especially, may start earlier. A patient who has had a mother who had breast cancer at a very young age, we tend to start sometimes even as early as in the 20s, but generally about age 40 we start doing them on a more regular basis.
Okay, well, we're going to talk about that next age group, but first we're going to pause for this minute.